Hello everyone, in this video we will talk about the fungal infection Cryptococcus. Now Cryptococcus is a systemic mycosis, which means it involves all of the organ systems and it is an opportunistic infection. So opportunistic infection means that it will happen in patients with an immunocompromised state. So when the immune system is deficient, this fungus will attack and it will cause infections. The causative organism is Cryptococcus. So Cryptococcus occurs in 4 capsular forms. The capsular forms A and D come under Cryptococcus neoformans and the capsular forms B and C come under Cryptococcus gattai. So these are the forms, 4 forms A and D which are neoformans, B and C which are Cryptococcus gattai. Now how do we describe this fungus? This fungus does not occur in mold form. It does not have any mycelial forms. It only occurs in the yeast form or the budding form. So it is seen as round or ovoid yeast which is capsulated. So it will have a capsule. Round ovoid yeast which is capsulated. No mycelial or mold forms are present. In distribution, it is seen in soil and pigeon feces. These are the reservoirs or the sources of infection. And it is seen as an opportunistic infection in AIDS patients, as I mentioned earlier. The mode of infection is by inhalation of yeasts which are present in soil or in the pigeon feces. That is how the infection happens, by inhalation of soil and pigeon feces. In the clinical features, if we look at an immunocompetent patient, the infection is mostly asymptomatic. So in immunocompetent, it will be mostly asymptomatic, but in immunocompromised, the first system to be involved is the pulmonary system, which is obvious because the infection is acquired by inhalation. So the first organ involved will be the lung and it will cause pneumonitis. After that, the fungus may disseminate and viscerally it may cause infections in the bones and joints. It may cause lesions in the skin in the form of ulcers and granulomas. And the most serious complication is cryptococcal meningitis, which is most commonly seen in AIDS patients. So these are the clinical features which are seen: pulmonary, pneumonitis, visceral involving the bones and joints, skin lesions like ulcers and granulomas, and cryptococcal meningitis. This infection is diagnosed by collecting samples from the lung, the skin, or the CSF, and with these samples we can do a microscopy. Now this organism is not detectable on normal microscopes, so we have to use a special stain called the India ink stain. India ink stain is a negative stain, and the meaning of a negative stain is that when we do this sort of a staining, the background will appear dark and the organism will appear white or light in color. So that is how we detect this on microscopy, by using an India ink stain, which is a negative stain, where the background will be dark and the organism will be white. And after doing an India ink staining, what we see are capsulated yeast cells. The capsule is very prominent when we do an India ink stain. Next, for culture, we can do a culture on Sabouraud's dextrose agar, in which we will see mucoid or cream colored colonies. A special culture medium is used for Cryptococcus called Niger seed agar, in which we can see brown colored colonies. So on Niger seed agar, we see brown colored colonies. Cryptococcus is also urease positive. It shows urease test as positive. And one more method of diagnosis is lateral flow assay or by latex agglutination tests. So these are the diagnostic methods for cryptococcosis: microscopy with an India ink stain, culture on Sabouraud's dextrose agar or Niger seed agar, which is specific, it is urease positive, and it will be detected by lateral flow assay or latex agglutination test. In the treatment, we see if meningitis is present or not. If the patient presents with meningitis, then initially we treat the patient by giving amphotericin B along with flucytosine. So this is the combination, amphotericin B along with flucytosine, and then later we switch to fluconazole. But if meningitis is not present, fluconazole is the treatment of choice.